I'm here at the annual meeting of the North American Menopause Society. I'm sitting with this past year's president of the North American Menopause Society, and you are?
My name is Cheryl Kingsburg, and I am a clinical psychologist and chief of the Division of Behavioral Medicine at University Hospitals Cleveland Medical Center. I'm also the professor of reproductive biology and psychiatry at Case Western Reserve University School of Medicine.
Well, she's a really leading sex researcher and therapist, and I asked her, with so much wisdom and knowledge, what would you just suggest, because there was so much information shared at the meeting? And you said?
Well, what I said was I was thrilled to be able to run a pre-course on essentially everything your patients wished you knew about sex, but you were afraid to ask. What I really wanted the audience to take home with the pre-course was to inquire about sexuality with their patients. And what I want for patients and women in general is to feel empowered to talk about sexual concerns with their healthcare provider, because that's the place you should go first, because it is a medical issue. It isn't just all in your head. And I think that women need to understand that the impact of sexual health goes well beyond just the bedroom and impacts your overall quality of life, your relationships, your overall health, and you deserve to have healthy sexual function.
And one of the points that keeps coming up is how few women actually have a chance to talk about something that's so important. Maybe you could comment on that.
Interesting, there's a little bit of a conspiracy of silence. On the one hand, clinicians feel uncomfortable talking about sex. I still haven't gotten to every single clinician to empower them to feel that it is appropriate to talk about sexual health concerns. Sometimes because they don't feel like they have enough treatments in their armamentarium to offer to their patients.
Not prepared to help.
Right, they don't have the training and they don't have the opportunity to provide options. And on the other hand, we have women who aren't really sure where they should turn when they have sexual concerns, and they think, oh, I don't know, should I bring it up with my doctor or my nurse practitioner? So they're afraid to bring it up. Clinicians aren't really sure that they should be bringing it up, and so it's the elephant in the room, but it is one of the most important topics in women's healthcare, and so I tell everybody, from the healthcare provider, it's really their responsibility to bring that up, to open the door, and to women themselves, if their clinician is not bringing it up, you bring it up, and if they're uncomfortable, go find another healthcare provider.
That's a very key comment, because some people think they are where they are, and that's where the train stops there, but it doesn't. It keeps going on to other opportunities if that's not meeting the needs.
Well, that's also empowering. For women to take control of their healthcare means you don't have to just stay with one provider if they're not meeting your needs, if you don't feel comfortable with them, because we know that communication is key to good healthcare, right? We know that treatment is about adherence, not compliance, and that it should be individualized, and treatments should be about shared decision making between the woman and her provider to make the best decision for her.
So the take-home message is for women that sexual issues are common. That doesn't mean there's anything other than an opportunity to take care of them. And if your own healthcare provider isn't offering it, solutions or resources, then seek other resources or places for solutions.
Well, I would like to add,
yes,
in my presidential symposium, I took our audience on a little bit of a journey for the search for an aphrodisiac. So I really want to talk about sort of this double standard we have, even in 2018, that looking and researching treatments for women's sexual problems, particularly hypoactive sexual desire disorder, is somehow pathologizing a problem that women should just learn to live with. And we know it is the most prevalent sexual problem for women. Nearly 10% of all women suffer from this. And we know that desire is in the brain as much as it is in our relationships. It's biopsychosocial. There are psychological factors, cultural factors, relationship factors, but there are also neurochemical factors. And so to search for treatments that are evidence-based is appropriate. That's what we're doing now, but when you think, is this just something new we've been looking for? The fact is that since recorded time, we've been in search of that love potion number 9 or an aphrodisiac, and finally we're looking at science and evidence-based medicine. So it is now time to really appreciate that all of those over-the-counter things you read on the internet or in the back of a magazine, really look at that carefully and just don't believe the label, because they don't really have to follow the same strict guidelines as FDA-approved drugs. And think about empowering yourself to understand what evidence is and talk to your healthcare provider about what appropriate treatments might be.
Make sure the stuff works and don't just go with what they say, with the label says.
Correct. Marketing is amazing, but it's not always, don't always believe the hype.
Thanks so much.
Thank you.